Hi, I'm Dr. Olga, Obgyn. I'm happy to welcome you on my YouTube channel where I'm talking about female health, and today I want to discuss an ectopic pregnancy. Ectopic is when fertilized egg implants somewhere outside the uterus cavity. It may implant in fallopian tube, in abdominal cavity, and of course you can't save this pregnancy. And even more, this is a life-threatening condition. For example, the most common localization of ectopic pregnancy is a fallopian tube. When pregnancy is growing in the fallopian tube, it might lead to tube rupture, and tube rupture may cause an abdominal, very massive bleeding. And this massive bleeding might be a reason of hemorrhage shock, or it might even lead to death. So it's very important to pay attention on symptoms that you may have when you're pregnant. Sometimes ectopic pregnancy might cause no symptoms. Sometimes it may cause atypical early pregnancy symptoms like nausea, breast tenderness, missed periods. Actually, I have a video on my YouTube channel about early pregnancy signs, so you can watch it because there's a lot of them and I think it wouldn't fit in this video. If you are pregnant and you have an acute pain in your abdomen, pain which combined with fainting or dizziness, or maybe you even have a pain in your shoulders, then it might be a sign of a tube rupture, and this is actually an emergency situation. You need to go to a doctor, to a hospital immediately. Sometimes when people have an ectopic pregnancy, they might feel like mild cramps or discomfort in their lower abdomen. And this pain might be more on the left side or more on the right side of the abdomen. That would depend on the localization of ectopic pregnancy. Also, people with ectopic pregnancy might experience vaginal bleeding. So that's why it's so important to go to the doctor if you're pregnant and you have a vaginal bleeding, because it might be not only like implantational bleeding, but it also might be a sign of ectopic pregnancy. And now let's talk about risk factors for ectopic pregnancy. If you already had an ectopic pregnancy, you have an increased risk of getting ectopic pregnancy when you get pregnant next time. Smoking. The more you smoke, the greater the risk. Inflammation diseases, sexually transmitted infections like gonorrhea or chlamydia, endometriosis, and if you previously had surgeries, it all might lead to scar tissues. And as you know, fertilization occurs in the tube. Like egg is fertilized by the sperm in the fallopian tube, and after fertilization, this fertilized egg traveling down the fallopian tube to the uterus cavity. But scar tissues might block the fallopian tube and make this movement of fertilized egg to the uterus cavity impossible. Having some surgeries done on your fallopian tubes, for example, if you had your tubes tied, it also increases risk of ectopic pregnancy, of tubal ectopic pregnancy. Using intrauterine devices also might increase risk of ectopic pregnancy. It's not that often that a female gets pregnant while using intrauterine devices, but still, if you get pregnant with the intrauterine device, it's more likely for pregnancy to be ectopic. Using some types of hormonal contraceptions, like progesterone-only contraceptive pills, might lead to ectopic pregnancy. Fallopian tubes can contract. Contractions is what makes fertilized egg to move into the uterine cavity. And use of progesterone-only contraceptive pills could really affect those contractions. Some research suggests that females who have IVF have an increased risk of ectopic pregnancy. And the risk is higher for females who aged over 35. For ectopic pregnancy diagnosis, we need to check your HCG level. When pregnancy is ectopic, HCG level is lower than when pregnancy is in the uterine. So HCG level doesn't double every for every 48 hours, like it does when the pregnancy is in uterus. Also, if doctors have a suspicion that pregnancy might be ectopic, patients should undergo ultrasound. Not always ectopic pregnancy might be seen outside the uterus, but we definitely would see that there is no embryo in the uterus cavity. And sometimes laparoscopy is required for ectopic pregnancy diagnosis. Ectopic pregnancy might be treated with medication or surgery. If we're talking about medication, then you will have only one injection, and this one injection will stop fertilized egg from growing. In your body will absorb fertilized egg in about 4 to 6 weeks. If we're talking about surgery, usually laparoscopy is needed. And during laparoscopy, we might only delete the egg from the tube and leave the tube, and sometimes tube should be deleted. If doctor suspects that your tube is ruptured and you have an intra-abdominal bleeding, then you might undergo laparotomy. Laparotomy is when you have a big cut on your belly. Thank you for watching this video. I hope to see you soon in my next one. Bye.